So, an infection begins with the invasion of the body by pathogens. So, think of the infection as an unwanted visitor in your body. There are tons of microbial flora, bacteria in your body that are supposed to be there. In your bowel, you have all kinds of different bacterias. In any mucous membrane, you have bacterias. Then when you go on an antibiotic, all of a sudden you have diarrhea or you have a vaginal yeast infection or something, and that's because the antibiotic cannot discern good bacteria from bad bacteria, so it kills all of it, and then you have a problem. So just because you have a bacteria or a pathogen doesn't mean that it's a problem. It just depends on what the whole chain is. There are many types of pathogens, bacterias, so that would be Pseudomonas, C. diff. There are viruses, the flu. There are funguses. So when you hear yeast infection, that's a fungus. Protozoas, parasites, rickettsia, those are like little living beings that that need a host in order to grow. You also have to have a reservoir for the pathogen to grow. So when I think of reservoir, I always think of big bodies that hold water. So when you think of a reservoir, think of something that provides everything that that bacteria needs. It can be, a reservoir can be water, it can be food, it can be body tissues, excretions, contaminated oxygens, contaminated objects. But remember that the reservoir has to be a place where that infection, that bacteria, that protozoa, whatever, can actually grow, have a food source, and we'll talk about that. How does it get out of the reservoir? It can get out through the skin, through the respiratory tract, through the GI tract, through blood, through feces, through urine. Anything that's in your body that escapes in any way, that's the portal of exit. And how is that transmitted? Well, now we go back to our isolation precautions. Contact. This is the most frequent route of transmission. So what's contact? I touched someone's blood or body fluid accidentally. What's droplet? Droplet precautions is when you wear gown, glove, and regular mask. And the reason you do that is the actual infection is big. And so if this is the person's mouth, that droplet is going to go like this, about 3 feet, and drop. So that's why you only need a regular mask. Then there's airborne, and these are the respiratory illnesses, tuberculosis, some pneumonias, that the flu sometimes, even though we're using, just to make things clear, we use droplet precautions, but airborne bacteria is very lightweight. So instead of being like droplet where it drops like here, an airborne bacteria can go way out here and float around. Okay, so that's why you have to have the special N95 mask for airborne issues. Then there's vehicular transmission. So that means it has to have something to ride in. So it will be in the water, in the food, in the air. And then there's vector-borne transmission, and that's an insect bite. Portal of entry is how does it get from one person to another? Normally, it's a break in the skin. And remember that intact skin is the line of defense. If your skin is really dry, if you have a hangnail, certainly if you have a wound, you are more susceptible to being a portal of entry for a bacteria. Susceptible host. This is the most important link in the chain. If there's no place for that bacteria to live and thrive, they're not going to. So it depends on the susceptibility to and degree of resistance the individual has. This is why some people get the flu and some people don't get the flu. An infection does not develop until an individual becomes susceptible to the strength and number of the pathogens. So your body has to say, come on in, you're welcome, you can live here, and you can make me sick. But if your body doesn't do that, then there's no susceptible host and the infection can't grow. That is why you don't always get the flu when everyone else does. So if you've been immunized, say to the flu, to, measles, mumps, rubella, your body then creates antibodies, and those antibodies meet this infection at the door, and they say, I'm sorry, you're not allowed here. You're not going to grow. We're not going to give you the food supplies that you need. So you might as well just move on to someone else. And then you don't get the infection. So this is extremely important, and that's why you want to stay healthy. You want to stay well hydrated. You want to keep your immunizations up to date. All of those things are very important to prevent infection. So, as always, what's the nurse's role in infection control? First of all, you have to understand how infections are transmitted. So these past slides that I just went over and what's on that YouTube video are very, very, very important for you to know. So infection is the actual invader, okay? There are many types, including bacteria, viruses, fungi, protozoa, parasites, Brachypsida. The reservoir is where they grow. That could be in someone's body, it could be in food, any place they have an environment that works for that specific infection. They have to have a way to get out of where they are, okay? So if someone is HIV positive and they're spreading the HIV virus, that HIV can get out through that person's blood, it can get out through that person's secretions. Including semen, vaginal fluids, that kind of thing. Route of transmission. How is it going to get from one person to another? Contact means it has to be picked up. So you have to say, hello, infection. I didn't wear my gloves. So now HIV is on my hand. And HIV is not a good one to use because that would where you'd have to put it, it would die too quickly. But let's use hepatitis. Hepatitis you got from stool from one patient, you don't wash your hands, then you eat your lunch, and yes, through contact, you now have hepatitis. Thank you very much. Yuck. All right, portal of entry. How's it going to get in? Go from body A, your patient, to you. Remember, skin is the #1 defense. And then you got to make sure your hands are washed so nothing gets in your mouth. And then I repeat again, susceptible host. Are you immune to it? Are you healthy? What can you do to prevent that infection from growing in your body? So remember that very clearly. Infection control, the best thing to do is prevent an infection. If somebody has the flu, don't be around them. Love them from afar. Send them flowers. Make a pot of soup. Drop it at their door. A nosocomial infection is an infection that you catch or you acquire in a hospital or medical facility, nursing home, whatever it might be. And the reason they're so prevalent there is there's just so many people who are not only sick, but they also have, they're susceptible. You know, their immune systems are low. They're sick. The Joint Commission safety goal is to reduce the risk of healthcare-associated infections and comply with the CDC hand hygiene guidelines. If you are in a facility and the state's there or the Joint Commission's there and you don't wash your hands, you are just plain done. Or if I'm there and you don't wash your hands, yeah, gross. So we always have to comply with the CDC hand hygiene guidelines. And what are those again? Wash your hands before you go in a patient room. Wash your hands when you come out of the patient room. Doesn't matter what you're doing in there. You might not even touch anything. Wash your hands anyway. When someone has an infection, you can quite often see where it is at the site. Erythema, it's that hot sort of swelling. obviously heat, pain, purulent drainage, um, tenderness, swelling, induration, loss of function. People can have cellulitis of a joint, and you might see a little bit of swelling. You might not see any redness, but that joint won't even move because it hurts so bad. So depending on the kind of infection, it will settle in a certain site. Think about something as simple as a hangnail and all of the signs that it has. If you have a hangnail on your finger, you have that red, hot feeling. It's painful. Sometimes it has purulent drainage. It's tender, it swells, there's an induration. But do you really want to be using that finger when it's really sore? You can, but it will be very painful. Systemic infections are throughout the whole body. This would be like the flu. You know, those aches and pains sort of illnesses that just put us over the edge are really horrible. Flu being the top one in my mind right now. Patient will present with a fever, heart rate might go up. Leukocytosis, you know what that is? That means increased white blood cells. General malaise. I think general malaise is a symptom for almost every illness, and it means they're just sort of lethargic, no energy, just plain want to sleep. And honestly, that's a body's way of saying sleep so we can get this invader out of here. Sometimes patients in a systemic infection will be confused. For all of you who already work in long-term care, you know exactly what happens to an aging person who has a urinary tract infection. Anorexia, the patient doesn't want to eat. Nausea and vomiting. Diarrhea often occurs, and enlarged lymph nodes. And lymph nodes are like the garbage disposal system for the body. They do a very, very good work, and that's their way of saying, I'm gonna collect this invader, put it in the trash can. They take things to the liver, and off it goes to the trash can. And we'll talk more about what the lymph node system does later. Right now, this is just a basics on preventing infection. And let's review. What's the best way to prevent infection? Wash our hands and follow isolation precautions that are ordered. We control whether microorganisms spread, how we practice aseptic techniques. Start by protecting yourself and the patient. And if everyone does that, we'll be fine. Okay, so there's medical asepsis. This is plain washing your hands, wearing gloves and masks as ordered, and always using a clean technique. Clean technique means clean hands, clean gloves, clean equipment. And then there's surgical asepsis, which is totally not to reduce the pathogens, but to eliminate them. And this is what we're talking about when we talk about sterile technique. You have a sterile field, you have sterile gloves, everything's sterile wrapped. And again, we're going to talk more in depth about surgical technique later, but just know that there is a difference. And the difference would be a clean technique would be giving an injection. You go into the patient's room, you wear clean gloves, you swab the area you're going to inject with alcohol, maybe chlorhexidine, whatever, but it's usually alcohol. And you provide a clean technique in a clean environment. You do not have to have a mask on to provide, to give someone an injection. Surgical technique, on the other hand, would be, say, in the the same spot in the arm that patient has to have an injection, that patient has a cyst, and that cyst has to be removed with a scalpel. So in that situation, it would be a surgical procedure because we're actually going to cut open the skin. So in that situation, you would wear a surgical mask, you would have sterile gloves, the patient would be cleaned with chlorhexidine, betadine, products that are far more effective to eliminate bacteria before the skin is opened. Any sterile object that becomes unsterile or clean object that becomes unclean is considered contaminated. So you drop a syringe on the floor, you may not use it. Even if it still had its cap on it, it still could have bacteria on it. Sterile field, if you get it wet, it's no longer sterile. If you cross it with something that's uncontaminated or that's contaminated, it's no longer sterile. Again, you learn that. All of these things you learned in clinical when you did Foley's. So this is video 2. I'm going to stop it here.